Aqeel, Camila, and I teach touch. And today I'm going to talk to you about a touch technique that's used for women who've had mastectomies. Over the years, the most important thing that I've found being a touch therapist is the art of touch. Well, this touch today we're going to talk about is touch for you. So we're going to talk to you about self-touch with your mastectomy area. Now, the most beautiful thing about self-touch is it creates a platform for self-appreciation, self-love, and it just makes things go better in your life. So what I'd like for us to start out with is clean hands, a glass of water near your area, near an open window where there's light and sunshine if possible. If you're living where I live, forget about it, but that's okay too. The light from the window is great. And you might want to have just come out of the shower or a nice bath. Now, I like to use an old-fashioned lubricant called castor oil of castor. And I like also to warm this oil. It's very thick and gooey, but when it's warm, it tends to be more liquefied so that you can use it. And you want to have an eyedropper because the castor oil is very thick. So in your warm oil, place your eyedropper and place 3 drops in the palm of your left hand, or if you're right-handed, I'm left-handed, so I start there. Now just slowly begin to put your palms together and massage the oil into the palms of your hands. If you have oil left over, then this is good to start your touch. If your hands are dry and you've usurped all the oil, then put 3 more drops into the palms of your hands. And now we're ready to apply touch. Now I want with your thumb and the next 3 fingers, place them on the front of each shoulder. Your left fingers on your left shoulder and your right fingers on your right shoulder. Just hold that stance for about 30 seconds. Now, while you're holding that, just sense the energy coming through your fingertips into your shoulders and take in nice deep breaths. And exhale. And now take your hands away and massage them together again, the palms of your hands, and then take your right hand and place it on the left area of your chest area there, especially the area where you've had the mastectomy. Without this particular touch energy is devoted to women who have decided not to have reconstruction. So we're just working on the flat surface of your chest, the bony surface of your chest, and mostly the little space or line of the incision. Now we're just on the left side, and we're just going to take our forefinger and our thumb, find your center of your chest. It's called the xiphoid process, that bone there. But go to the center of your chest and just pinch your way out. Pinch your way out from the center of your chest into your axillary. That's the area under your arm. Okay? Let's do that again. We're going to slowly and gently do a pinch effect where we're crawling with our forefinger and our thumb in that incision track from the center of your chest out and under your axillary, so under your arm. Go as far as you can. Very good. Now, you may have been using a little pressure, but I'd like for you to use a medium amount of pressure now and start again right in the center of the chest at the xiphoid process, right at the line of your incision, and use more pressure going across. So you're going to bring your forefinger and your thumb together as a little Pac-Man or little pinching kind of effect. This actually brings lymph and blood flow to the area, so it makes for a very healthy platform. It's a very good thing to do first thing in the morning, in the shower, and at other times that we're going to talk about when we're in the process of lovemaking. Okay, so now take the complete palm of your hand and push your hand across the area that you've just done the creepy crawler. So again, we're going to do that 3 times. You're going to take the palm of your hand, start at the center of your xiphoid process, and push that tissue all the way into your axillary, which is the space under your arm. One more time, and this time you're going to use your ring finger and you're going to use pressure in the line of your incision. Now, we're searching for soreness and tenderness. At this time, I have none because I've been doing a lot of work on my area. But when we have tenderness and soreness, we want to gently stay in the area where the soreness is and just work a little longer there. Now, you might want to shut this off and if you're really sore and do that, but I'm going to go ahead and move on to the other side. Now, let's do one more, full palm open, hand open, and pushing the tissue from the center of your chest on the left side to the underarm. And once you get under the arm, I want you to sort of pump your hand about 7 times under your arm. So feel that tissue under your arm, and we're going to pump 7 times. 1, 2, 3, 4, 5, 6, and 7 pumping. Okay, and now you're going to slowly drag your hand back to the center of your chest. Allow it to fall down onto your lap, and then we're going to do the opposite side. So take your left hand, start in the center of your xiphoid process, and you're going to go on the line of your incision, and the forefinger and the thumb are going to just bring that tissue closer together across the line of the incision. Remember, we're looking for soreness, and where we find soreness, you're going to stay there a little while. And you'll notice that more blood flow and lymph will come to that area, and then it won't be sore anymore. Okay, so we've done 2. Let's go again 3 times across with your thumb and forefinger, pinching the tissue at the line of your incision into the axillary, which is under your arm. Okay, now we're going to open palm and go over that area again. So flat palm, open hand from the center of your chest to the underarm. Do that again. Very good. Oh, that really feels great. So continue to do that, alleviating all the soreness. And now we're ready to cup the underarm with the left hand, and we're going to pump 7 times. 1, 2, 3, 4, 5, 6, 7. Very good. Okay, now bring your arms down. Take both hands, place them right hand on right side, left hand on left side, and push the tissue toward the center of the chest. So start at each axillary, at the opposite axillaries. Your palm of your hand is flat on your chest, and you're going to push the tissue toward the center of your chest. Okay? And we're going to do that 3 times. So start at the axillary, push the tissue toward the center with both hands. Very good. And once more, push the tissue toward the center of your body. And now, with loosely closed fist, start at the top of your chest and march down your stomach from there's a little little nodules at the base of your throat called the clavicle notches. Grab a hold of those and pull the tissue down the center of your chest. Just one hand over the other, pulling down, pulling down. Come on down to your belly, pulling down to your navel. You can stop at your navel and rest both hands on your navel, and now make circles at your navel. So you're going to go circling to the right with both hands pressed on your navel, circling to the right. Now let's circle to the left, and we're going to circle to the left. And now we're going to spread our hands out and bring that energy away from your navel and out to the sides of your body. So both hands are going to part at the navel and push that energy and tissue out to the sides of your body. Very good. Okay, now loosely tight, slightly loose fist, and you're going to tap all around your navel, just tapping. Loose fist, just tapping. Make a circle around your navel, tapping, tapping, tapping. Go to the opposite side, tapping, tap, 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 tapping, tap. And now slowly and gently place your hands, the palms of your hands spread out over your navel and spread the tissue out to the sides, both sides. Left hand taking tissue to the left and right hand taking tissue to the right. And now come back. You might want to put a little more oil in your hand. So go to your eyedropper and put 3 more. You can use 4 more drops of oil into the palms of your hands. Start to rotate them, rotate your palms, and make sure your hands are slightly lubricated. You don't want it too messy, but you want to have some lubrication on your hands. And now you're going to come back with your fingertips on your shoulders and just rest there and take a nice deep breath. Just keep your fingertips resting. Try and sense if there's energy coming through your fingers and going onto your shoulders. So just rest your fingertips on your shoulders right now and take 3 nice deep breaths. Now, slowly place the palms of your hands face up in your lap. Beautiful. Breathing is the most important thing that we can do, of course, right? Because it keeps us alive. And this concludes part 1 of Self-Touch for Beginners. Please practice.